was interested in the Ready-to-Work program because I really wanted some clinical experience before starting my actual clinical for school, and the PRN aspect of it really caught my eye to work with my school schedule and working outside of that.
I wanted to get more experience outside of the classroom, and when I looked into the Ready-to-Work program, I saw that you get pay, you get loan forgiveness, and then after you graduate, you have a job. And so after that, you can get loan forgiveness or you can get an incentive bonus. So why not? I couldn't pass up this opportunity to come to the Ready-to-Work program.
So in class, when I go in for clinicals, they just assign me to a different nurse every week. I have my instructor who probably is with me about 10 minutes every time I'm there. But through this program, I'm with my one preceptor, and already we have such a strong bond. It's super great going in and out of the rooms with her, and I get to see everything that happens on the floor, except for just one patient for a few hours a day.
So whenever we go in, we are able to see, what patient we're going to have for the day and go over the exact skills that we'll be doing, and you get that undivided attention to fully perform those skills instead of having to share or divide that up between other students.
So my preceptor has been absolutely wonderful from the moment I worked my first shift. She's told me there's never a bad question. She's never gotten tired of all of my questions that I may have for her, and she goes out of her way to show me things and teach me things that she knows that I don't know. And she actually graduated from USC a few years ago, just like the program I'm in now. So she really understands my learning needs, what level I'm at, and the things that a student needs to see.
It makes me very excited and confident that I'm able to apply the skills that I'm learning in the classroom 2 days later on the floor. There's this feeling of learning about, this is what a fluid volume deficit or overload looks like, and only a few days later seeing that in the hospital, or even the other way around. There have been times when I learn about stuff on the floor, I talk about it with my preceptor and go into class and I'm like, hey, I already know what this is. And so the Ready-to-Work program really is preparing me for that, as well as getting me used to the environment of the floor, what it's like to be with patients, and I'm able to go into this field confidently knowing that I've had the skills and ample amount of time with the supporting group to really get me ready for this profession that I love.
So my typical shift in the Ready-to-Work program, I normally start at about 7 and we do huddle. And then after that, we get report from many different nurses about our patients that we're going to be taking care of for the day. Also after that, we go and get meds and we do assessments. I watch her do assessments as well as she lets me do some assessments. But after that, we go chart what we've seen and what we've done. And then throughout the night, people just come grab me and we go do bed baths, we go do linen changes, and all sorts of different things that I can do within my scope of practice as a Ready-to-Work student nurse.
We had this patient who kept complaining about the soda tasting silly or funny. And my preceptor said, okay, we're going to fix that. So we actually left the room, went down to the cafeteria and bought her a fresh Pepsi from the vending machine. And when we were doing it, she said, she's been here for a few days. She's a little bit upset. And if I can do one thing to make her stay a bit better, why not go and do that one thing? And just on the way back up in the elevator, I was thinking, who else would have done this for her? And it made me realize that these are the nurses that are going to be with the patients every day, and it's our job to not only care for them and their health, but to make sure that their mental and emotional well-being is also there. So just having that moment where she was caring for her on a level that you don't learn about in the textbooks, but have to be on the floor and see, it made me realize that she's just so wonderful, and this is the kind of program I want to be in, because you get to have that real experience with a person who treats the patients like they're people.
So I've always been a very shy person. I was very scared to go into the hospital for the first time and actually take care of people. It felt like a huge responsibility, but being able to go in for the first time and have a one-on-one with my preceptor really showed me how to be confident with patients and how to do that nursing care. And it's definitely benefited me in the long run and made me much more comfortable going in for clinical and any future hospital setting.
It's been very life-changing so far, and I know that through this program, it's going to make me a better nurse. It really is, and I just can't wait to see where it's going to take me.
I think that as a new grad, It can be very overwhelming, and it's very nerve-wracking in a way. But through the Ready to Work program, I've seen that, it's not just you alone with all of your over a handful of patients. It's fully a team effort, and you're going to have that comfort and that care and that support throughout the entire team. And I think that the Ready to Work program has really shown me that you're never going to be alone in nursing. There's always going to be people to help you. So it's not as scary as it may seem whenever we graduate. So with the Ready to Work program, I'm more excited than I am nervous to finally get my BSN and be an RN and start my career as a registered nurse.